Hello everyone, I'm Dr. Prateek Joshi. This patient has developed twisting injury to his left knee joint and he has sustained left knee joint lateral meniscus complex tear involving posterior horn and the body of the meniscus, and he also has complete anterior cruciate ligament tear. On diagnostic arthroscopy, you can make out that there is a complex tear involving posterior horn and the body of the lateral meniscus, which we are going to repair in this case with all inside meniscus repair device. So first I am going to take a vertical mattress stitch just anterior to the popliteus tendon. As you can see, I have taken bite through the superior portion of the torn lateral meniscus. Once I am sure that the needle has pierced the substance of the meniscus and across the capsule, I am going to deploy my first implant. After deploying the first implant, I am going to gradually withdraw my needle. And now I am going to take bite in the inferior portion of the torn lateral meniscus. After taking the second bite through the substance of the lateral meniscus, I am going to gradually withdraw the needle, and then I am going to pull the thread to lock our knot over the torn lateral meniscus. And now I am going to cut the thread to complete our first vertical mattress stitch. I was using anterolateral portal for visualization, anteromedial portal for instrumentation, which I am going to change now to reach the posterior horn of the lateral meniscus. So here I am going to take the medial most bite in the lateral meniscus, and I am going to take my first bite through the posterior capsule inferior to the lateral meniscus. Just like before, I am going to deploy my first implant and withdraw my needle, and then I am going to reach over the superior aspect of the tear and pass my needle through the substance, and then deploy my second implant and then gradually pull out the device. After pulling the thread and tightening the knot, I am going to cut the thread with suture cutter. Now I am going to take one more bite slightly more anterior. I am going to pass my needle over the superior portion of the lateral meniscus through the capsule, and then deploy my device and withdraw the needle, and then I am going to go towards the inferior portion of the torn lateral meniscus and then deploy my device. After deploying the second implant, I am going to gradually pull the device back. And then I am going to pull the thread to complete our knot, and then I am going to cut the thread with thread cutter. So this completes our lateral meniscus all inside repair, and you can see this is the final picture after the meniscus has been repaired. So the first part of our procedure is over, and now we are going to shift towards arthroscopic ACL reconstruction. This is the picture of the left knee joint as seen through the anterolateral portal. You can clearly see the intercondylar notch is empty and the ACL is completely torn. After identifying the femoral footprint of the ACL, I am going to insert the femoral femur and hyperflex the knee joint, and then proceed with the guide wire insertion through the lateral femoral condyle. So the guide wire has been inserted, and now we are going to drill with endo button drill bit over the guide wire. The laser markings on the endo button drill bit help us to know the provisional length of the femoral tunnel. So the depth of our femoral tunnel is 38 millimeter. This is the view of the lateral femoral condyle as seen through the anteromedial portal with guide wire in situ. You can clearly see that we are right in the native ACL footprint. Our graft diameter is 9 millimeter, so we are going to use 9 millimeter drill bit to drill in the femoral condyle. Here we are going to use 20 millimeter continuous loop endo button, so the length of graft which will remain in our femoral tunnel would be 18 millimeter. We are going to drill up to mark of 28 millimeter with 9 millimeter drill bit in this case, because we intend to keep 18 millimeter graft inside the femoral tunnel, and we need this much distance of over drilling for facilitation of flipping of the endo button. This completes our femoral tunnel preparation, and now we are going to start with tibial tunnel drilling. I am using ACL jig for tibial tunnel, and I have kept the angle to 55 degrees, and I am going to drill the guide wire through the tibia with the help of this particular jig. Since our graft diameter is 9 millimeter, I am going to make our tibial tunnel slightly more posterior. This helps to prevent impingement of the graft. Now I am going to sequentially drill over the guide wire with 6 millimeter drill bit first and then 9 millimeter drill bit for the final tibial tunnel preparation. This completes the tibial tunnel preparation. Now we are going to shuttle our graft through the tibial tunnel and femoral tunnel while the endo button attached to it. Once the desired length of 18 mm of graft has occupied the femoral tunnel, we are going to flip our endo button over the lateral femoral cortex. Then we are going to do cyclic loading of our graft before fixing the graft at the tibial side with interference screw. This is the final picture of our ACL graft as seen through the anterolateral portal. You can see the graft is robust in size as well as tension, and it is in the anatomical footprint. This is how the graft looks from the anteromedial portal. This completes the procedure. Thanks for watching this video. Do like and share the video and subscribe to the channel. If you have any queries, you can ask in the comment section. We are going to keep this patient non-weight bearing for 1 month since we have repaired the meniscus, and apart from that we are going to restrict knee bending to 90 degrees till 1 month from the surgery.